Hey guys, Jarrod here from Elite Foot Care, running you through an uncommon case of an ankle injury which may occur after a simple inversion ankle sprain. Now this case that we're discussing today is regarding os trigonum or posterior process of the talus fractures. The prevalence of this injury occurs in roughly 0.86% of all ankle injuries, so it's not very common. However, it's very commonly missed when it does occur. Misdiagnosing ankle injuries that occur like this can create significant issues long-term for the athlete or person injured. This case we're running through is of a 17-year-old boy who was playing football, who got tackled from behind and had an inversion and hyperextension or plantar flexion related injury. Upon initial presentation, which was one day after the injury, this patient presented with pain in the posterior aspect of the ankle joint. There was minor swelling and small purple discoloration in the Kager's triangle. Our initial assessment involved a comprehensive ankle assessment looking at soft tissue ligamentous integrity and the Ottawa ankle rules to rule out any bone fracture. After an initial examination, we were unhappy that there was no pathology, so we would refer for imaging, an ultrasound and x-ray of the ankle. After this patient went and got the x-ray, we had a look at the images. Once a report came through, it reported no pathology. After reviewing the images, we were happy to see that this injury was missed. In all cases which I've seen this injury, they have been missed initially upon initial assessment. We were able to see a thin fracture line in the posterior aspect of the ankle joint. Now clinically, we were unable to confirm whether this was a fracture of an os trigonum, which is a secondary accessory bone, or the posterior talus process fracture. Due to the high clinical suspicion of this injury, we then referred this patient for further MRI. And then once again, after this patient got the images, we looked at the report and no concern regarding this area was reported. We then assessed these images again and we were able to see a very clear and defined fracture line occurring at the posterior ankle joint. Now, most recent literature and systematic review conducted by Engelman et al. 2020 would suggest the majority of these ankle injuries respond better from surgical management. In discussion with this athlete and assessing the following season, we agreed to trial 6 weeks of conservative management with a failure of treatment to then constitute an orthopedic referral and surgery. Initial management involved immobilization and offloading on crutches for at least 4 weeks. After 4 weeks, we reviewed the patient and found a significant reduction in ankle pain palpation, as well as the review x-ray showed improvements in that distinct fracture line. Now, in cases where we'd review the MRI and see that this fracture is displaced and not well congruent to the ankle joint, it would result in an immediate referral. However, my clinical expertise and opinion believe that we would be able to successfully manage this injury with conservative management. Now, due to the improvements of the initial assessment, we then started to include a gradual progressive rehabilitation program that involved non-weight bearing restoration of range of motion and gradual resistance plantar flexion with TheraBand. After another week of complete immobilization with the gradual progressive rehabilitation program, we were then allowed to slowly restore this patient's weight bearing. Now, this began with partial weight bearing while remaining in a moon boot over the next 4 weeks. Over that time, we were able to continually improve this patient's strength with the graduated rehabilitation program, focusing on the loss of strength which occurs with any period of immobilization, so restoring range of motion, as well as proprioception, beginning to focus on balance and ensuring there was no asymmetry with the other side. This then progressed over the following 6 weeks, where we began easing the patient out of the moon boot, being conscious of the injury, ensuring we don't re-aggravate or push the ankle too far. We were happy that the patient was aware of their ankle injury and understood the importance of not occurring further aggravation. Now, from initial injury to then final review, we were happy that strength had restored, that there was no significant pain or palpation surrounding that ankle. We conducted a number of return to sport criteria tests, including hop tests, including side to side hop tests, vertical jump height, as well as other tests including a review of gait, both walking and running. At 14 weeks, we were confident this athlete was able to return to normal play, eased back into training sessions, while monitoring with a clinical assessment that there was no re-aggravation. Now that patient was able to return to normal play, pain-free, and upon 12-month review has had no further aggravation of the ankle joint and remains playing at a higher level than what the athlete was performing prior to injury.